name is Chanel Robertson. I'm the community manager for the Digital Benefits Network here at Georgetown University's Beck Center. You've probably received some type of communication from me, and if you haven't, you might get lucky after this call, but you should have received an invitation to this call if you're already a part of the Digital Benefits Network. You'll also see many more faces from our Digital Benefits Network team in today's call. I'm really excited to jump into today's call, but before we launch into the conversation, I'd like to go over a few housekeeping items and then pass it to the fellow for the Digital Benefits Network, Ariel Kennan, who will be moderating today's conversation. Excuse me. All right, so please note we are recording this call for our archives, and the replay will be available and shared in the coming weeks. Also note that transcription is available as an accessibility feature. You must enable it on your Zoom by going to your navigation bar at the bottom, clicking more if you have a lot of things up there, and selecting live transcript, and it'll give you the option to enable or hide it if you want to remove it. We also encourage you to have your questions ready. So we will start off with a panel conversation, but we will open it up for Q&A. So our panel will be followed by 15 minutes of Q&A, and we ask that you use the raise hands feature for that to ask questions, or drop your questions into the chat box. If you do that, please kind of denote that you're sharing a question with question for panelist : so that we can make sure that we're getting your questions to the moderator so they can ask the panelists. We'll also be sharing occasional links with you from our team. So be on the lookout for that in the chat box. We'll be using the chat function for that. And you'll also receive a resource link that will have all the links in one place. So we'll be dropping a lot of links, a lot of information, a lot of resources today. At the very end, we'll drop the resource document that you can find all the links that we've shared today. Please stay on mute unless you're presenting or asking a question during Q&A. And as always, please be kind in the chat and use respectful communication while you're with us today. It's not on the screen, but I always like to share the norm of make space, take space. As a former educator, we encourage everyone to make space for others, but we'll be doing a lot of talking, the panelists as well. So please take up space. We want to hear your questions. We want to hear from you, so don't be shy. We love engagement. And speaking of engagement again, and a shameless plug, if you want to share what you've learned, and I hope that we're all going to learn a lot today, follow us on LinkedIn at Digital Benefits Network and on Twitter at BeckDBN. To add to the online discussion, you can use the hashtag DBNQC, and you'll get those links in the chat box. One thing that we ask is please don't share the Zoom link publicly or on social media, as we want to keep this conversation to those who have RSVP'd. So thanks for your help with that. And one final reminder that the Zoom is being recorded. And with that, I'll pass it to Ariel to share more about the Digital Benefits Network and increasing security and equity in electronic benefits transfer, which is EBT. And that's why we're here today. Ariel, I'll pass it over to you.
Thank you so much, Chanel, and thank you to all of you for joining us today for this important conversation. If you're not already familiar with our Digital Benefits Network, we're a group that convenes practitioners who work in and alongside every level of government to spark dialogue, share resources, and support the better digital delivery of public benefits and services. You can visit our website to learn more about how to engage with our communities of practice, our research, our tools, and publications. Our website is digitalbenefitsnetwork.org. And one of the tools we produce is the Digital Benefits Hub, which we launched last October with the American Public Human Services Association. The Hub is a dynamic open source library of resources, case studies, and implementation tools for public benefits professionals like yourselves. And you can access that at digitalbenefitshub.org. But I want to really dive into today's conversation. So much of the benefits modernization discourse is focused on easing access and applications for benefits like SNAP and WIC and TANF, but much less recent attention has been paid to the technology and systems involved in the distribution of benefits to ensure their security and equity. However, if you've been watching the news, the coverage over the past year has shown the growing problem of EBT theft really necessitates urgent action. Today, we're going to explore what's happening on the ground, the types of benefit theft that are occurring, and how data design and technology can be leveraged to upgrade the EBT system. To aid in that conversation, we've prepared a resources document where you can access the relevant government documents, news coverage, and recommendations that we'll be discussing during our conversation. And also in that document, you can find full bios of all of our panelists. You can access this document at beckcenter.org/EBT. It's also in the chat, as well as scan the QR code in this slide. So EBT was a technological innovation when it was launched back in 1984. It provided an electronic record of every transaction, as well as easier distribution of benefits. And in order to roll out the system, the Food and Nutrition Service created detailed steps and regulations on how transactions flow and the interactions between the many stakeholders, including beneficiaries, retailers, states, and EBT processors. And really until recently, EBT had been considered a secure technology, or at least had not been targeted in quite the same way. But over the past year, theft of benefits has grown exponentially. Take these local news headlines from across the country. It really is happening in every state, and some states are hit much harder than others. While there's actually limited data currently on the full extent of theft, some of the reported numbers are truly shocking. In Los Angeles County, back in 2021, $1 million were stolen. Last year in 2022, that grew to 19.6 million. And this past January set a new record with 2.9 million of benefits stolen within the month. As another data point, in a survey recently conducted by the Providers app of over 4,000 SNAP users, preliminary data shows over 40% of people who reported being victims of benefits theft had their benefits stolen more than once just in the past 12 months. But thankfully, Congress has actually taken some action in the most recent omnibus package to include a section on EBT benefit fraud protection. It calls for increased security measures, investigation into how and where fraud is being committed, and the replacement of benefits on a limited basis. And in response, the Food and Nutrition Service recently put out a policy memo with guidance on state plans for reimbursement, data tracking, and adoption of future security measures. And these are due really soon on February 27th. So we're here to have this conversation as a really timely matter. So action is happening, but there remains a huge opportunity to upgrade the technology and systems behind EBT. In fact, we've seen one state, California, include EBT theft prevention and technology upgrades in their budget for this fiscal year. And in Maryland, the state legislature has bills before its House and Senate on EBT upgrades, reimbursements, and other provisions. And we're also seeing great movement within our federal agencies with FNS piloting technologies like mobile payments. So we hope that this is one of many conversations to come on how to increase security and equity in EBT. Today, we're joined by two experts who can help us untangle what's happening and what can happen in the near and long term. First, please welcome Ashley Burnside, who is a social policy analyst with the Income and Work Supports team at the Center for Law and Social Policy. She specializes in refundable tax credits, TANF, access to food benefits, and disability policy issues. And next, I'd like to please welcome Amelia O'Rourke Owens, who is an engagement and policy fellow in the Office of Community Affairs at the Consumer Financial Protection Bureau. She brings a diverse array of professional experience in consumer protection, policy, and program management to the Bureau, where she focuses on harmful financial products and their impacts on low-income populations. So let's dive into our conversation here. Ashley, I was hoping you could start by telling us more about what's happening on the ground and who's being impacted by this theft.
Yeah, absolutely. And thank you so much for having me on the webinar with you all today. It's really important to be raising awareness about this issue. So I really appreciate the Digital Benefits Network for hosting this very timely conversation, like you were just saying. So as you all saw from the headlines that were shown on the prior slide, there have been rising cases of benefit theft throughout the nation over the past year in various states. This means that for SNAP and TANF recipients, they are being left without their monthly benefits through no fault of their own. These monthly benefits are intended to help families afford food, formula, and other essentials. And families budget around this money and have now had those funds stolen from them during times of inflated grocery prices. What this can look like is a SNAP recipient coming to a grocery store checkout counter with a cart full of groceries, only to realize that they have no funds in their SNAP account, even though the benefits were just loaded on for the month and the prior day. This can lead to frustration, embarrassment, anxiety, and for too many families, they now have an unplanned hole in their budget and didn't even know the funds had been stolen from them until they tried to make a purchase. Some of these thieves are using the stolen funds to purchase large quantities of things like baby formula or Monster energy drinks, things that have a large shelf life and are more expensive in value. And then when a recipient goes through the multitude of steps and phone calls to report the theft of their benefits to their SNAP state agency, they often have been told that there's no reimbursement options for them. So last year, most states weren't reimbursing recipients for their stolen funds, with a few exceptions. Families have been left with little recourse, often being told that they can change their PIN numbers or to be on the lookout for skimming devices in retailers, but those don't prevent the greatest threat from happening. And even though there was often no question that their funds had been stolen, there was really no support provided to the recipient once this occurred. Some families have reported going to ATM machines at midnight, risking their own personal safety just to withdraw their TANF deposit right when it was put into their account, with the hope of preventing someone else from stealing their funds from them. Families have been left with very few other options besides taking these kinds of actions to protect themselves. And thankfully, with the recent passage of the federal omnibus bill, states can now start reimbursing recipients for those stolen benefits using federal funds in certain circumstances, but there will still be some families who are left out from that legislation. So there really are a lot of individuals and families with low incomes who are being impacted by this, unfortunately. Parents are left having to go to food banks and stretch their budgets and having to jump through bureaucratic hoops to report their stolen benefits, and have been previously left with really no support up until now.
Yeah, so many of the stories that are getting coverage are really heartbreaking. And I think also a lot of beneficiaries feeling like there isn't much recourse, whether they're going to the government, the administrating agency in government, or to law enforcement. And so I think we're really letting down our folks. Amelia, from what we know, theft of EBT benefits is occurring in a few different ways. Could you help us with some of the definitions on the types of theft that are occurring?
Sorry, I didn't have unmute permissions until. So I think that EBT theft can happen in a lot of different ways. But there are three big terms that or buckets maybe that I think is useful to think about these. And the three big ones are EBT, are card skimming, and then card cloning, and then there's EBT fraud more broadly. So for kind of to level set, card skimming is a practice when a card's data is stolen from a point of sale device, and this is much more easily happens on magnetic stripe cards. Card cloning is what happens when card information, EBT card information, is duplicated onto a blank or other stolen card. And then oftentimes cloned cards are being filled with the data that thieves are obtaining through card skimming. And then finally, EBT fraud can be facilitated through a lot of different vehicles, whether it's phishing, spear phishing, which is hyper-targeted phishing efforts, calls, emails, or text scams that accidentally result in clients sharing their account information that enables an account takeover by some means. So those are the big categories that I think of. And I think it's also important for us to note that EBT benefit thieves are technologically savvy, and they are continuously evolving their practices. So a lot of this theft is being perpetuated by sophisticated criminals and or organized crime rings. So I think it's I want to really emphasize that this is something that's happened. It's scaling up, and that it's very advanced, and that this is not, simple user error, that there are some systemic forces at play that are really making this a scalable venture for criminals.
Yeah, it seems to be the latest target in some of the criminal rings going after many of our benefits programs, but using different techniques that maybe go at particular weaknesses of those programs and their infrastructure. But definitely an emerging and growing trend. Thank you for those definitions. Ashley, back to you. Building on your excellent blog post, what can states do right now to help reduce theft and limit negative impacts for benefits recipients?
Thank you. Sorry, I won't mute myself again since I can't unmute myself. So first and foremost, I just really want to emphasize that the burden of preventing EBT theft and skimming should never be falling on the recipients who receive these benefits. It really ultimately should be the responsibility of state agencies, of EBT processors. So it's really on states right now to think about how to address this issue. That burden should not be falling on recipients. But there are quite a few actions that states can be taking to address this. Of course, creating resources that inform recipients about the risk of skimming and theft is important. Making sure those resources are in easy to understand language, have photos, such as a photo of what a skimming device can look like, though I'll flag it's very hard to detect those things, kind of like Amelia was saying, but it can be helpful for people to at least understand what that is and what to look out for. The information should include steps that recipients can take to protect their benefits, and also what they should do to report the theft if it occurs to get reimbursement. State agencies can also raise awareness of what common phishing practices are in that state. For example, telling recipients to not text information about their account or to answer calls from unknown numbers, especially if the state agency knows what are common practices in their particular area. Letting recipients know to have more complex PIN numbers to help prevent the risk of someone being able to steal it. And anytime that state agencies are communicating to recipients about these tactics or creating resources, it's really important to make sure the blame is never placed on the recipient and that there's no shaming or stigma that comes with falling victim to these crimes. As Amelia was saying, these are very, very complicated crimes and very technologically advanced. It is no one's fault if they fall victim to them. And it's important to not have any stigma for people to come forward as this may continue to happen. States should also be reimbursing recipients for their stolen benefits as promptly and efficiently as possible, even beyond the scope of the omnibus bill. For example, if somebody had up to 3 months of benefits stolen through EBT theft, the omnibus bill only allows for up to 2 months of reimbursement with the federal funds, but states can still use their own funds to reimburse that remaining month. And that's, of course, the right thing to do, given that this is money that's going towards people's food costs. Also, for anybody who had their benefits stolen prior to October of last year, the omnibus bill unfortunately does not provide them with reimbursement. So there were a few key states that were already giving that reimbursement last year. It's definitely important to follow their trend and to keep doing that. And as states do the reimbursement, it's important that they make the process as efficient and easy as possible, not creating undue burden for people to prove that they had their benefits stolen. And if there's a time window where recipients must report their benefit theft by, it's important that states communicate that to folks so they know what time frame they have to report their theft by in order to get their reimbursement. And as was said earlier, there are states like California that are already allocating resources in their budgets to address their EBT system and make it more technologically advanced and secure. I encourage all states to do that and follow that example. The more that we can update this technology, it'll make the cards less at risk of falling victim to these crimes. And of course, there's a lot of data collection that states can be doing to really identify trends in what theft looks like in their state, where it's happening, how it's happening. And I can talk more about what that data method can look like. I see a lot of hand emojis in the chat.
I think we're all sharing that many of us, although might not be EBT users, have had our debit or credit card skimmed or stolen. There's lots happening. You know, it's the private sector is not immune to this either, has just put some of the protections in place. Amelia, maybe let's go to you to talk a little bit more about data, and then we can come back with Ashley and close the loop on that piece.
Sure. Well, I want to share one resource and one best practice with the states in particular on this call today for using data, as Ashley was just, kind of suggesting, to prevent skimming and to protect recipients. So one resource is that the CFPB's Chief Technologist Office is doing trainings for state governments on using data and technology. And that's called How to Build a Technologist Team and Integrate Them into Casework. You can email me or iga@cfpb.gov to ask to be invited to one of these trainings. Second, I want to say, as a best practice to the folks on this call, don't be intimidated by your data. And I don't mean that condescendingly. A lot of you, whether or not you work with them every day, already have a lot of infrastructure in your states for assessing and dealing with EBT data. And so work with those departments or divisions that are already focused on EBT data, that are looking right now probably mostly towards user or vendor fraud, and using that data analysis for detection of those types of fraud. And work collaboratively with them and that existing infrastructure to identify EBT theft patterns. And remember that ultimately all data analysis starts with a human asking a question of the data. And again, I don't mean that condescendingly. I think sometimes, I know for myself, when I hear data analysis or algorithms or technology, I feel that I'm not, a technologist by trade. But when you're thinking about the fact that it's a human asking those questions at the beginning of a system, think about your users in your state and their typical patterns of use of EBT cards. And then also think about, what are our signals that theft may be occurring? Some of the ones that we're seeing nationally are flurries of out-of-state activity. Like skimming is happening here, and then they're making online purchases in another state, and then seeing a bunch of out-of-state transactions at one time. That's a really good place to start. Another one is thinking about, is there flurries of extremely high benefit spending within hours of deposit on the card? So we're talking, if your state reloads 2 days a month for your users, and you see a flurry of activity that's spending down the entire benefit amount, or upwards of 80% of that benefit amount, that's going to be another signal that something is amiss. While we know there's typically a lot of activity at the beginning of the month, it's not 100% of the benefit in most states for most constituents. And then another flag on that, in that vein, is full amounts of benefits being depleted at one time or in one transaction. So just remember, and don't be intimidated, that data analysis starts with a human thinking of what's normal, what questions do we ask of our data, and then also thinking about how can we be using this data analysis to prevent theft, but not make the user experience more difficult for our clients.
Ashley, did you have any other points you'd like to add on that front?
I think Amelia really covered it. The important thing is to really be identifying patterns and trends, noticing when it seems likely that theft is occurring. And of course, I encourage states to share the data they're collecting with other states, with the USDA, with other government agencies, so we can hopefully learn from what's happening in other regions and target outreach and information to reflect what we're learning from the data that you all are collecting. But I think she really covered a lot of it there.
Excellent. Amelia, back to you to talk about some of the parity between consumer card technology. How has that been changing, and what specific considerations need to be taken for the EBT market that might be different than that consumer market?
Yeah, I want to start this off again with a vocabulary primer, so we're all working on the same language here. The four big terms in card security and technology are PINs, which is short for personal identification number, but I will also refer to it as a PIN number, which sticklers would oppose. Magnetic stripe, CVV, and EMV. Don't worry, we'll go through those. So PINs, the 4-digit personal identification number. My understanding is all states do a card plus a PIN. If for some strange reason your state has been able to get away without requiring a PIN, change that immediately. But another thing that states can do is, and this would be a mirror to industry standards, is banning simple PIN numbers. So many of us may have had the experience of trying to create a password or trying to create a PIN number over the last year or two, and the interface that we're working with just rejecting it as not complex enough. That's a reasonable measure for states to put in place to protect against skimming, but is not a foolproof measure, I should add. Magnetic stripe or mag stripe, this is what all EBT cards currently use to conduct their transactions. Magstripe is the technology that provides the consumer's payment credentials to the merchant that takes the card. And then the merchant uses that information to authorize the transaction. On Magstripe cards, that information is static. So every time a consumer is swiping a Magstripe card, the information that's transmitted is the same. And so that's why on point of sale devices, Magstripe cards are so at risk of skimming. And that brings us to EMV, which is better known as chip security. That actually stands for Europay, MasterCard, Visa. It's a registered trademark. This is definitely industry standard. I would say this was in Europe before it was in the United States. It proliferated in the United States starting in about late 2015, early 2016. The reason that chips are more secure or better at preventing against skimming specifically is because at that exchange of the payment credentials to the merchant, it creates a dynamic data point. So every time a chip card is used to execute a purchase, it's a new unique data point that's created by the combination of the chip card and of the terminal. So that's why they're generally more protected for in-person purchases. It is certainly industry standard to have debit and credit cards secured with chip cards for the reasons that I've laid out. There's no law requiring credit card companies to give individuals a chip card, and that's true for debit cards as well. And there's no law saying that stores have to install terminals that can read chip cards, which is another, I think, analysis point here. But speaking on the evolving consumer trends, in October 2015, card companies and stores changed how they divide up responsibility for card fraud. And those changes created incentives for merchants to install card terminals. And for banks and credit unions to issue chip cards. So a lot of merchants have adopted this technology. And I do not want to diminish the complexity of the EBT vendor marketplace, but I do think it's important for us to be looking carefully at how some misalignment may have happened here as one industry is evolving and another has not kept pace with that. And then finally, there's card verification value or CVV number. And this is the number that's on the back of most credit cards. And CVV's function is almost like a PIN number for the card. That's not an official definition, but that's a way that you can think of it. And so the CVV number belongs to the card rather than you, and they're usually required for online purchases. And this is another additional element of security that is industry standard that that adds to that level of security for online purchases. So I want to bring it back to the evolutions in theft prevention, that chips have been a significant advancement for card security for in-person purchases, but they're not infallible. And they're effective at reducing skimming, which can prevent thieves from being able to clone multiple numbers onto single cards or multiple cards. But it's important to note that it is only effective for point of sale, for preventing point of sale theft. It wouldn't prevent, for example, card numbers being compromised on unsecured networks. And it's also only effective when the chip terminal is actually being used rather than the mag stripe. And then CVV is another component that I think we should be considering that is very much so industry standard, but that can also add that additional layer of security to online purchases.
Thank you. I think the definitions there are very helpful as we think about the possibilities on how EBT can evolve. We're starting to get some great questions and comments in the chat. And so I want to turn over to our audience to be able to ask you more questions. We've covered a lot of ground so far. And so I ask everyone, if you'd like to use the chat box, you can put in a question in there. We also would love to hear from more voices. So if you would like to share your question, if you could use the raise hand function, and we'll ask to unmute so you can ask your question and get a response. One question I saw come in already from Jessica Radboard. Do you think it's also possible to track this theft at the retailer level, i.e. at a particular retailer? Can we see in real time that EBT cards from a variety of states are being used to back or fully draining the cards?
I love that question. And I think that's a great example of all data analysis starts with a human at the beginning. Of course, that would be kind of a two-factor level of analysis that you'd want to be working, unfortunately, backwards from clients who have reported themselves to be skimmed, but being able to zero in on a specific point of sale device that is common among all of them is a great example of being able to work backwards and also kind of trying to cut this out from both directions. And also, I would add, it's one that doesn't significantly increase the burden on the recipient, which I think is another theme here today.
Yeah, and I'll add that if a state is identifying that there's particular stores within certain counties or certain neighborhoods, hopefully there can then be targeted outreach to recipients who live in those areas to potentially be aware that skimming is heightened in their area and at least be aware of the risk. So again, hopefully using those trends, even if it's after the fact, potentially then being able to circumvent additional skimming devices that may be placed in the same region in the future.
Yeah, I love that of being able to use the data to see those patterns as a way that could happen. I will just share, because not everyone might know, is that the USDA FNS and as well as the states have retailer fraud reporting hotlines or email addresses or forms. So that does put it back on the beneficiary, but it is possible currently to also report retailers for issues, including skimming. Next question is from Toral Patel. Is it clear to states who they should report to if they identify these kinds of trends?
Definitely reporting to the USDA, reporting in to the federal agency. I will note that the memo that was referenced throughout this call that was given by USDA to states saying that within 60 days, there will be a plan for how to reimburse recipients and also implementing security measures and creating more of a contingent plan of reporting skimming. In those plans as well, states should be identifying their plans for using data analysis for reporting theft trends. And hopefully that can give more clarity as well to what other states are doing as more states are submitting those plans by this deadline of the end of the month.
Next question, also from Jessica Radboard. What do you think is a reasonable timeline for implementation of EMV chip cards, and do you have an estimate on the cost?
I don't have specific answers to that, but what I will say is I think that this is a good example of cost benefit analysis, that there is a lift here, and it's important for us to acknowledge that. There's a lot of states on the call today, and they are the central gatekeeper for a lot of different stakeholders. They, are responsible to their frontline staff, to their clients who are receiving benefits on EBT cards, to FNS, to ACF, to a lot of different parties. And also the vendor marketplace for receiving EBT SNAP benefits specifically is a very specific and complex market. But I also think, again, there's a very substantial harm here. Food insecure families are losing their benefits. Children are not getting fed because their family doesn't have the money that they have specifically designated to spend only on food. And so what I would say is there is one other complexity with chip security is that would most likely introduce interchange fees into the EBT card transaction universe, which currently is not at play. And there is a common myth that chip cards are chip cards are more substantial than mag stripe cards, but chip cards have become much more affordable recently. There was a supply shortage kind of during the nationwide supply shortage over the pandemic, but that's coming down now. And the difference between mag stripes and chip cards has been reduced to, I believe, in the cost of close to $1 per card. So that's not insubstantial, but it's also not cost prohibitive, perhaps in the way it would have been even 5 years ago.
I also think if you look at it in the scale of benefits being stolen currently out of the system, makes those cards seem very inexpensive as an investment piece. Obviously, there's a lot of other technology that has to upgrade along with it. It's not just replacing the cards, but the theft ratio is getting so large now. It just, money is pouring out there. Next question is from Ann Kornarski. There's currently a specific carve out for EBT cards used for state and locally administered means tested benefit programs in the Federal Reserve System Regulations 12 CFR Part 205, Regulation E, often called Reg E, which means they have less consumer protections. Is this still true in practice? And is there any movement to change this? And will EBT providers and banks not support this change? I'm happy to kick off and answer and then ask for follow-on. So the Consumer Financial Protection Bureau recently put out proposed rulemaking around this with a question and the target was at small businesses for the rulemaking responses. But there was a very specific question on should EBT cards be included in this? And us at the Beck Center, as well as other organizations who are on this call have really said strongly EBT users deserve the same data rights and protections as consumers in other financial products. We submitted that as our response. There's a blog post that's in our resources document as well, but very hopeful that this will change. Ashley, Amelia, other things you would like to add on that?
Yeah, well, I would say that, to the question about Reg E not covering state and locally administered needs tested benefits, that is still true. That's the regulation. As Ariel mentioned, we the CFPB just released a SBREFA outline on rulemaking around 1033, which is consumer rights to access their financial data. And so I do want to clarify that 1033 is kind of a more narrow lens of accessing that data. But I also think that that's an important flag that different states have different contracts with their providers. And so there are a lot of states where consumers can't see their transaction history, or, the way that they can get that data is more limited, or maybe less user-friendly, or maybe just not equally available to all consumers based on their access to broadband, for example. And so I think that that is all that I can say about Reg E. There is still the carve out for state and local needs tested benefits. 1033 is addressing consumers' rights to financial data.
Yeah, to underscore that point, I'll flag that there's a lot of great information in this chat, so I hope you'll look through it. But one of the things that Justin King put in is that according to Propel, there are about 20 plus states where individuals can't see that retailer information or their transaction history. So like Amelia was saying, it does vary state by state what information EBT users do or don't have access to. And that makes it harder for folks to protect themselves, to be able to use the cards and have access to their financial information, which is why some of these proposed regulatory rules are so important. I've been hearing the phrase, a lot of people saying that EBT users are really seen as second-class consumers when compared to people who use marketplace debit cards and credit cards. And I do think that that's an important framing. Folks aren't able to access the same data, have the same protections, have reimbursement when they are fallen victim to these crimes because their cards don't have the same technological advances. And all of us on this call, of course, are proponents for people who use EBT cards to have the same protections and rights as other consumers. So it is important for all of us to continue raising these issues as not only expensive to states, but also equity concerns. So I do think that it's great that there's more and more awareness being raised to how important these regulations are and who's being left out.
Thank you both for that. Next question is from Haywood Talcove. How do you address the issue of account takeover driven by people calling into the agency or using their webpage?
Yeah, account takeover is a bit of a quagmire. I would say that, you know, at the Bureau, I work in the Office of Community Affairs, which is our special populations office focused on economically vulnerable populations, but we also have 3 other populations office: older Americans, students, and service members. And this is an issue across the board. You know, there's definitely different ways that this is manifested. I think technological savvy definitely comes into play here. And so I think to Haywood's question, there is some consumer education, there is some awareness. You know, I think the messages around "we will never ask you for this in these ways" is really a useful thing to just say. You know, if you're getting something that asks you to enter your information here, don't do it. You know, it doesn't matter. It is confusing though, because I get text messages from my bank when my credit card was skimmed last year, and I found out about it because I got text messages from my bank. Of course, it just said, "Is this, you know, true, yes or no?" But I think also to my earlier point about that skimming is happening by advanced technologically savvy criminals and oftentimes at organized crime rings. I do want to say that account takeover is also getting more and more advanced. We've seen recently this uptick in computer virus alerts where they're saying your computer has been taken over, and then the consumer has to call to fix it. And it's very savvy, you know, that as we get aware of what's going on, these become more developed. And so I think account takeover, if we want more specific systemic level changes to banning the PIN numbers, having some layer of authentication between being able to act, like if you're calling in for an account balance, for example, having some degree of account verification in order to hear that balance would be useful. And then, you know, obviously, again, banning 1234 as a PIN number, or banning, you know, the name of your SNAP program as a password or something like that. Those are systemic changes that states can work with their vendor on to provide additional security and to prevent account takeover.
We have time for a few more questions. Would love to hear from any states who are on the call, or if others have thoughts or ideas that they want to share. The chat has been great and really rich with resources and information as well. Well, I'm going to ask Ashley another question, which is what else do we think Congress and the federal agencies can be doing? Because our omnibus package was just one and a short-term solve on this problem.
Yeah, of course. And I just wanted to uplift one of the comments in the chat that does relate to this from Vicky Nigus. Sorry for mispronouncing your last name, Vicky. Just raising that no states that we're aware of have submitted plans to FNS yet about the omnibus package. So there's still a very timely action at this moment from all of us to encourage our state agencies to have a plan in place that will be as burdensome as possible and as efficient as possible for reimbursing recipients. And that timeline is quickly approaching. But as far as other actions that can be taken in the long term, I would advocate for permanent replacement of benefits when the theft or skimming occurs beyond the scope of the omnibus bill. In the future, assume that way recipients are always protected if they fall victim to these crimes. There's always reimbursement in place in the same way that if any of our credit cards or debit cards are stolen from, we will be reimbursed or covered from that happening. And broadly speaking, like we've been talking about this whole time, seeing federal protections for consumers who use EBT cards, seeing the same protections for EBT cards that other consumers have under regulation and law. And I do think that there should be more accountability to EBT vendors to make sure that the cards are keeping up with modern technology, whether it be through chips, through any of the other mediums that Amelia talked about in more detail than I possibly could. By having accountability there, it ensures that we're not constantly playing this game of catch up where there's yet another scam that's happening that we're trying to update our card technology to respond to, ensuring that these cards can maintain the level of protection and technological security that was intended when they were created, as we talked about at the beginning of this presentation. But of course, technology is constantly changing and moving. And I do think that there should be a continued expectation that states are sharing what's happening, what trends are occurring, and that agencies like the USDA and the Department of Health and Human Services will create more materials as we get more information from states about what's working and what's not working in the months ahead. If there are states that are doing an exemplary job of reimbursing recipients in a timely way or of using data to identify trends, hopefully there will be some webinars, some memos that really lift up those themes. So hopefully states can continue to learn from each other and find solutions that can really best meet the needs of clients.
Thank you for that. I think we have one more question from Jessica Radbourd. I'm worried that verification will become burdensome for victims. So like they're reporting back and verifying that you were the victim of theft. Can you share thoughts maybe on how we can make that reporting less burdensome for beneficiaries?
I think I would say going back again to data and using existing infrastructure that states have. I too share that concern. And I think, just fundamentally, I think in terms of efficiency, it doesn't make sense to create individual level solutions to things that are systemic problems.
Mm-hmm.
And so, using that as you're purely an efficiency analysis, starting from that point, using your existing data infrastructure, it might be needing to think a little bit creatively, like having, standing up a committee that can ask questions to identify this, that is proactively identifying what the state thinks is skimming, before you're even hearing complaints. Other examples might be, working backwards. Once you do have this spate of, reports of theft from a certain time, doing some postmortem analysis on that, looking at, were there common terminals where these, consumers were making their purchases. I think, again, this is all going to go back to, let's think about this efficiently. And efficiency is not going to be answered at the individual scale. So how can we use existing infrastructure and maybe just expand it, or just shift its focus even temporarily, to be able to identify what are clearly patterns and larger problems?
Thank you for that. We're coming up on time. So just quickly, any final words of advice? I feel like we could have a many-hour discussion on this, but just in closing, Ashley, Amelia, if you wanted to share just a final quick thought.
I don't know if I have much else to say, except thank you all for being on this call and for advocating for this issue. I do think it's really important we continue to raise awareness and lift up these stories, lift up these solutions. So I just appreciate all of the work and advocacy you all are doing.
Yeah, I think I would conclude by acknowledging the task that lays before states as difficult. I mentioned earlier that states are a gatekeeper to a lot of different stakeholders. They're running information down from FNS, they're reporting information back. They've got their frontline staff that need to be trained and informed of developments. And then, of course, and I would argue most importantly, they're end users of their benefits, SNAP recipients, and TANF recipients, of course. And so I want to acknowledge that this is a problem, and that states, kind of sit in this unique place where they're wearing a lot of hats. But one thing that I would really emphasize is using resources like the Digital Benefits Network to be able to work collaboratively with other states so that y'all aren't reinventing the wheel. I think someone flagged earlier in the chat that California rolled out CAV on their cards and it hasn't been effective, which is different than CVV, but still I think is a good flag of something that has been tried and hasn't been effective. So using the resources available to you where you're not having to reinvent the wheel, maybe even like quickly pulling together a dossier of best practices or things that have worked and haven't worked. And I know that there are a lot of really smart, thoughtful people who are engaged in this work, and the Bureau sees those stakeholders. We understand that everyone is trying to solve this. And so the CFPB does not back down from intimidating or large problems. And, we just invite you to engage in this challenge so that people can have and make use of the benefits for which they're eligible.
Thank you so much, Ashley and Amelia, for all of these insights. I'm going to pass it back to Chanel to close us out.
Awesome. Ashley and Amelia, thank you so much. Ariel, thanks for moderating. That was a great Q&A session. Thank you, everyone, for all your participation, and thanks for joining us. We were really thrilled to have you with us today, and we're looking forward to your contributions to the Digital Benefits Network. As we wrap up, we'd like to take this opportunity for a Zoom poll to learn more from you, our attendees, about what you'd like to see in our future quarterly calls going forward. And if you haven't already, please join and subscribe to Digital Benefits Network to stay informed and in the know about our upcoming events. In closing, we'd like to share a final reminder to join the DBN and follow us on LinkedIn and Twitter to stay up to date and connected. The links will be in the chat. Please reach out to us at digitalbenefits@georgetown.edu with any lingering questions, comments, or feedback. So please take a moment right now. We'll leave the poll open for you all to just give us some quick feedback. And with that, the Digital Benefits Network is wishing you all a gorgeous spring, despite what the groundhogs had to say. And we hope to talk to you soon. And if you have any questions lingering, feel free to put them in the chat. And the resource link document, the link to the resource doc where all the great things from the chat were shared, you can also find them there. So again, thank you so much. And we hope to talk to you all soon.